Welcome back to another episode of Ponea TV, and thank you for joining us. I'm Dr. John Kyalo, the Clinical Technical Lead at Ponea Health. I offer a clinical perspective to the technology products that we develop here at Ponea Health.
My name is Daniel Mumo. I am in the Clinical Operations Department with a particular focus on the quality assurance of the providers that we bring on board our platform.
In the previous episode, we discussed the public healthcare system, its roles and the challenges faced in delivery of healthcare to the masses. In today's episode, we'll focus on the private healthcare system and how the roles it plays in filling in the gaps that have been left by the public healthcare system, as well as the challenges faced in the system. In our previous discussion, Daniel, we talked how would you say the private healthcare system fills in the gaps that have been left by the public healthcare system in regards to accountability.
So the private healthcare system has more resources, largely because of the private funding that it has received. So because of this, they have been able to set up the necessary systems to be able to build onto the existing infrastructure to manage patient records. So we have electronic medical records which are managed by the private healthcare systems. So this essentially allows the private sector to have stored records of all of the patient data, and so when you go for consultation, you don't have to keep on opening a new record. We have all of the patient records in one spot, accessible to all of the doctors at the click of a button. So what this has done is to enable us to track the patient healthcare records from once they enter the system to once they leave. So what this has enabled the healthcare system to do is to have greater accountability on the actions of each doctor to each of the patients. We'd be able to know that, okay, Dr. Kyalo went to visit Dr. Mumo, for example, on this and this day. These are the presenting complaints. This was the actions which are taken and the outcomes of the patients afterwards. So we would be able to track that this was the correct action which has been taken by the doctor in line with the government healthcare protocols and also the international protocols. And therefore, this would allow for effective tracking of the actions of the doctors and the outcomes of all of the patients.
And I think it's also important to note that with all the tracking that we're doing, we're also able to track not just the doctors, but everyone involved in the healthcare of the patient. We have a lot of people-centered factors that contribute to patient outcomes, but we've also got non-people related. Even within the people related, we have the auxiliary staff who play a key role in patient experiences and outcomes.
Yes.
And we've also got, records in terms of whether medication was available, the diagnostic and curative aspect of the entire healthcare system.
Yes.
And how available these were at the time of whatever intervention was required.
That's correct. What we are coming to find out more and more is that the well-being of a patient needs a more holistic approach as opposed to the traditional approach of just prescribing medications. So the food that the patient eats, the environment that they're exposed to plays a very, very critical role in the outcomes of each and every patient. So Dr. John Kyalo, I think we have gone in depth on the accountability of the patients. There are also other factors in the private healthcare sector which contribute to the well-being of the patients and to why it has been the go-to aspect for many of our clients.
Another major gap that the private healthcare system comes in to fill that has been left by the public healthcare system is in terms of quality of healthcare that is provided to patients. This is largely due to the resourcing which is available at a higher level in private institutions. And this affects not only the human aspect of the care for the patients in terms of who cares for the patients, but we've also got the tools of trade that are required to care for the patient. So these include, the lab reagents, the diagnostic imaging, equipment that's required, the maintenance, the replacement in situations where maintenance has reached its end, or rather the equipment has reached the end of life. And we've also got, in general, the auxiliary functions in a hospital, such as cleanliness, which are offered, by the auxiliary staff, the beddings required, linen, the nitty-gritties of healthcare delivery. So all these greatly impact patient outcomes. So in terms of these differences in quality of healthcare, they really affect, the outcomes of the patient. We could go from preventing secondary infections, preventing secondary illnesses that are gained or acquired from within the hospital. And we've also got optimal treatment in terms of outcomes by monitoring progress of patients to prevent over-medication, under-medication, or unnecessary procedures and investigations as well.
Yeah. And I think that these also, the additional resources allow for prescription of the correct medication for the correct diagnosis, as opposed to having to improvise with different medications to cater for one set of disease, correct?
As opposed maybe to shooting in the dark, you know?
Yeah.
Hoping one of the bullets lands.
Yes.
Yeah. I think another issue that we would say the private healthcare sector comes in to fill in would be the issue of you know, the business needs or rather the entrepreneurial needs that members in the healthcare fraternity need to have met.
Yeah, that's quite accurate. I mean, largely we have a lot of strikes by doctors who are complaining that their compatriots have not been employed, for example. So in a way to support the government, all of these private funds or sectors that have come up also help to create employment. They help the more entrepreneurial doctor to also have a separate source of income. They would also help to give employment to not just the doctors and clinicians, but other auxiliary staff, because in a hospital, food still has to be cooked, floors still have to be cleaned. So all of this just helps to raise the GDP of the country as a whole by providing employment to multiple people within the sector. Now
moving away from, you know, the gaps that are filled, some of the challenges that we face as members of the public primarily, seeking these private healthcare, you know, services.
Yeah.
I would say the most prominent one of them would be accessibility. When I say accessibility, I'm talking cost, you know?
Yeah.
The cost of private healthcare can be astronomical.
It is, and I think this is largely due to the initial cost of setup that is required for these facilities. There's a large capital investment that is required for them to be set up, yeah? And I think it normally takes quite a number of years for the return of investment to come back to the initial funders of the business. So this may tend to, the cost may tend to be pushed over to the patients, where now the cost of services, for example, consultations and lab tests may go up. So this is one of the shortcomings of the private sector. So Dr. John Kyalo, what other shortcoming of the private healthcare sector do you think contributes to inaccessibility of healthcare to the common mwananchi?
In terms of private healthcare facilities, you know, and how they have been distributed across the country, they are largely centered around Nairobi, around the major towns, and, you know, trickling out, peppered very distantly from the main towns and the main cities in the country.
Yeah.
And as such, this means traveling hours and hours to arrive at a healthcare facility when you're already unwell.
Yeah.
You know, so we have that key issue of distance as well is a major challenge.
It is.
We've also got the added challenge that, you know, if you have to travel from here, let's say Nairobi to a distance of about 50 kilometers to the next hospital, private hospital, you have to leave your children at home, you know, who's going to care for them, who's going to come visit you daily, offer you the support in terms of material resources, and even just emotional and spiritual, you know, support through the period of illness.
Yeah.
Yeah.
I guess it's also compounded when you have a young child who is unwell, who now you have to travel for those 50 kilometers with in order to receive quality healthcare. Yeah. So Dr. John Kyalo, I think in this episode we have managed to highlight the reasons for the building of the private healthcare society as well as its shortcomings. And in the next episode we will look at the misconceptions about the healthcare practice in the country as well as the role that Ponea plays in bridging the gap between the public and the private sector.
If you have any questions or insights you'd like to share with us, please leave them in the comment section below. And if you'd like to get a notification on our next video, please click the subscribe button and the notification bell as well. Thank you, and see you in our next episode.